Hey, this is Doctr Night Class. Go ahead and click like and subscribe below. Hope you enjoy the medical content. So let's talk about these flavors, okay, of arrhythmias. You have two flavors of arrhythmias. Two flavors, okay? You have arrhythmias that affect the atrium, which is going to be your P wave, which is going to be your SA node, right? And then you have arrhythmias that affect the ventricle, which is going to be your Q, which is going to be your QRS complex, and your AV node. Okay, so there's two flavors: the arrhythmias that affect the P, the arrhythmias that affect the Q. There's two flavors. Okay, let's talk about the first flavor. All right, so these are the ones, the arrhythmias that are going to jump out at you. They're just going to jump out at you. Okay. All right, so they're very, very specific characteristic, very specific, okay? And it was stated that sometimes there's a regular rate. We measure the rate from the RR interval. And you see these red lines here? From this R complex to this R complex is a certain length, but then it's a different length here, okay? So now we can say it's an irregular rhythm. Okay, now what's our next step? We look at P and we look at Q, right? There's something wrong with P. P has some kind of squiggle, okay? This squiggle in P plus an irregular rhythm, that is enough to call it atrial fibrillation. We're done. That's it. Once you diagnose, you move on. So once you determine this, you don't have to look at all the other leads. You're never going to get an arrhythmia on an exam, and then they want you to know if there's a myocardial infarction too. You're not going to have two diagnoses on a question. It's not going to be an atrial fibrillation and a myocardial infarction. Once you find out the answer, go find the answer choice and click it and move on. Okay, so we only made it to step 2 here, right? Okay, great. Now the other flavor, these are very distinctive. They look alike. How do you distinguish these? All right, so we know here that the rate here, the RR intervals are normal. And they're pretty much the same in length. Pretty much the same in length. Okay, now we look at the P and the Q. So the rhythm, we see that our P is all messed up. Now this feature is called sawtooth. It looks like teeth, right? It looks like teeth. Someone's gonna bite into a New York bagel. I want a New York bagel, okay? Sawtooth pattern. The P wave has to do with the atrium, right? Atrial flutter. You have your diagnosis, move on. Do not look up and down the other leads looking for an ST elevation. You have your diagnosis, move on, okay? Great. The only time I want you to look up and down the leads for ST elevations, if there's no problem with the P and the Q, and there's no problem with like the rate or something. Okay, but if there's no arrhythmia, you need to go look for myocardial damage. There's no arrhythmia, look for ST elevations. Okay, all right, so arrhythmias here, we're still going. We have our first degree. Our first degree, remember this is the atrium, so we're only talking about the P wave, right? So our first degree is just a prolongation. There's an increased space between the P and the QRS complex. That's it. There's no complex drops. So the P is a complex, QRS is a complex, they're all there. None of these are missing. A drop complex means that one of these spikes, it's gone. They're all there. No problem, okay? That's first degree AV block. Second degree AV block, okay? So basically you have these intervals, they call them PR intervals, but still it's the atrium, so we're talking the P wave. Not a big deal, okay? So let's look at these distance. Okay, so from the P to the QRS complex, this distance looks short. Go to the next one. The distance looks long. The distance looks even longer. Eventually, there's a drop of the QRS complex. That's second degree AV block. Okay? They call it Mobitz type 1. There's a type 1, there's a type 2. Type 1, there's a type 2. Okay? PR interval is normal, so there's no increased distance, there's no prolongation between the P and the QRX. These are normal. And then all of a sudden, there's a drop of the QRS complex. This one's a little harder to distinguish, okay? A little harder, because the P wave looks pretty normal. So the third degree AV block, it's basically, they usually don't ask this on the exam. Usually don't, okay? But basically what happens is the PR interval becomes so prolonged, and then there is, this is actually a narrow QRS complex, but the specific thing you look for is that this is an elongation of the RR interval. This is super long, right? Super duper long. So this basically means that this is called a junction space. You only see a junction space with third degree AV block. So this is very characteristic. You're less likely to go after this. Now remember, we have characteristic arrhythmias. We have fibrillation, which has difference in RR intervals and the little squiggly P waves. We have a sawtooth that looks like someone bit a bagel, but the RR intervals are the same. And then we have this characteristic one, the third degree AV block. We have this junction space. Huge, huge, huge. Okay, they're probably not likely to go after that. Okay, this would be like a diagnosis of exclusion. Like there's nothing else, it's this. Okay.
Hey, Dr. Eric, on the first degree block, if you can fix the node, you just say prolonged intervals occasionally. I know it's prolonged PR.
Yes, exactly. They call it a PR interval, the space between P and the QRS complex. Okay, the space between. So this is basically the depolarization of the SA node. This is the depolarization of the AV node. Okay, we know that one is supposed to happen before the other. Okay, but if there is a great delay between, sure, it's called the PR interval being prolonged. These are very common. They may go after that. Well, test questionable. These are very test questionable. They go after that, sure. Okay, I think that this one is more test questionable, Mobitz type 1, than Mobitz type 2.
For more night class content, go ahead and email me at doctrnightclass@gmail.com. That's DOCTR nightclass@gmail.com. Hope you enjoy the content.